Do you want to say something a little bit about techniques? I mean, you mentioned this is where the professional might have some techniques at hand, right? What would be some of those tools in the toolbox?
And that's one of those things that it's exciting to live in the day and age that we do because there's so many different options, which is really exciting. And it also speaks to the reality that it is a really challenging thing to bring healing into. So I think there's both sides of that, but probably historically, a lot of CBT or cognitive behavioral therapy has been used, and that's still very effective. But that, again, is probably going to be more effective with a single PTSD kind of trauma experience where you're trying to think about engaging the mind and the beliefs and trying to rewrite or reshape those beliefs. And there's certainly value in that. And so that would be one of the techniques for sure.
With that technique that Brian is talking about, a lot of that is when you're walking with a person through more of like a trauma-focused CBT therapy, you are doing that piece of like making sure that they have skills for regulation and understanding unhelpful thinking styles for what they are. And then it's helping them walk through the very specifics of what was a trauma and being able to write about it or process it verbally in order to kind of organize it a little bit more in the memory and then kind of move on to making meaning out of it, of what we've talked about, which again, just to what Brian had said, that works well with trauma that has a clear start and a clear end.
And so a lot of what you're talking about there is like really helping bring the hippocampus on board so that it can help create a memory around it. So that's meaning, that has the right meaning, that has the beginning, that has the middle, has the end, and it's coherent would be one of the things that we would say in counseling. And where that kind of memory is there, it's still painful, but it starts to be a memory instead of something that like writes the whole story.
And that actually makes sense to me because PTSD is really the past hurt bringing itself out in the present, right? Which is all comes via memory, doesn't it? Mm-hmm. So being able to rewrite memory and setting memory free, in a sense, is at the crux of the matter. It seems to make sense.
Yep, exactly, and it's really helping it be a full and accurate, memory that you have some degree of mastery over, and then so other techniques that we would use as well, and so this would kind of fit into what Kathy is talking about there. Would be exposure and kind of reducing the avoidance would be a part of that, and then things that maybe people have heard about, but maybe
let's not race along too quickly. Exposure. Say a little bit about what you mean by that.
Yeah, so exposure would just be, again, the reality of like, okay, this is what happened. Let's sit and talk about what happened in a really kind of slow, methodical, so you're letting the experience hit, but you've worked enough on that safety and stabilization that you've got tools to stay within what we would call as the therapeutic window. So it's not overwhelming your system, but you've got tools to help, there's certainly a lot of emotional charge around it, but you're able to sit with the memory and process it and help.
So going back to your example, bring the child into the kitchen.
Exactly.
And see that the kitchen is not the threat.
Right. So the first level of exposure might just be standing on the very edge and like, oh, okay, yeah, I can handle this, and nothing happened. Okay. And then you get a little bit closer and you get a bit closer and eventually you touch the stove. That would be the example of what exposure would look like in that kind of a scenario. Yes.
Sure.
I think it's important just to mention from an exposure perspective that some of the things that you have in play there is you have the therapeutic relationship with the counselor. And so there's that sense of safety that's already built. And then also just, Brian said this already, but kind of the scaffolding in place of like, we've already worked on stabilizing emotions and you have tools in your toolbox to handle the distress that comes along.
And I think that would be, I wouldn't want, this to lead to everybody like, okay, well, let's just, expose, that's not the idea, because there needs to be a lot of things in place, and the other person needs to be in agreement with that, because a big part of trauma is a lot of times their voice doesn't get accounted for, and so that's a big part of the trauma work, is making sure that their voice is heard and has an impact on the present, so that they
so you can't force it.
Exactly, you can't just force it.
Because that would unwind. That would unwind the meaning.
Exactly. It reinforces the wrong meaning that's already in place.
Yeah, Brian used the word the therapeutic window of tolerance or distress. And that's a really important thing that just maybe as a trained counselor that we have our eye on as we're walking through these experiences and unpacking trauma with people.
Meaning that there's enough emotional arousal that they're kind of, you can see that, okay, we're in the right vicinity, but it's not too much that's overwhelming the system and then reinforcing what we're trying to de-enforce. So another one that comes to mind that maybe people have heard of or are like, man, what in the world is that, would be called EMDR. So EMDR is short for eye movement desensitization and reprocessing, truly a mouthful. And even the author or the originator of it wish they would have renamed it at this point because they've learned so much. But EMDR is really it's been found to be very helpful in trauma work, partially because it's the theory behind it, at least, is that it's able to do the bottom-up approach where it's able to kind of impact the body and the limbic system or the emotion and kind of get underneath the logic and the defenses that come with the logic. Because a lot of the defenses are really around the meaning that's been put to stuff that we're trying to shift. And so if you can get behind those and under those, then that can help shift things.
So there is a very close tie with our experience in our bodies and how we feel in our bodies, our memories. Things are much more integrated than perhaps what we had formerly thought. And so EMDR really works, you mentioned, from the bottom up, really paying close attention to the body and allowing that to give clues to the memory.
One of the unique things with EMDR is it uses something that is called bilateral stimulation, which means you're working with the person in therapy to stimulate both sides of the brain. And what happens really through the process of EMDR is the similar thing that happens in the REM cycle of sleep. So kind of how God designed our body to reprocess things as we're sleeping, that same process is happening through the EMDR process.
And it's really just trying to access a traumatic memory and then trying to basically help do the work of the hippocampus of turning it into more of like a normal or a helpful memory, not in the sense that it's good or that it's pleasant, but it's just been processed in a helpful way that it's a memory rather than something that just dominates.
A present reality.
Right. It's something
because that's what PTSD is. It's a present reality when it should be a memory.
Right, because that's part of what happens with traumatic memory is it doesn't get stamped with time. So therefore, you can't, is it happening now or did it happen then? And that's a big part of the work of like, nope, that was back then. And now what are things right now and connecting with the now?
Sure.
So so there certainly would be a lot of other approaches, but I think those would maybe just help give a few categories for folks and even just to think about that there are some top-down approaches, there are some bottom-up approaches, and generally speaking, especially with complex trauma, you're going to be trying lots of different things, and sometimes you might be, somebody might be in phase 1, and then you move into the processing, and then, that stirs things up, so then you got to move back into phase 1 and the safety and stabilization, and it's just a back and forth journey and just encourage just lots of patience, but there's also a lot of hope in it.
I think that's a really important point because I certainly see it a lot in the counseling room. It's not a failure if you're moving back towards, we just need some time to ground and restabilize. It really is all part of the healing process.